Good morning. So, in the next, what we are going to discuss into the coagulation mechanism and coagulants. So, already we have seen the blood flow or blood clotting mechanism. It is occurs into the three stages: vasoconstriction, platelet adhesion, activation, and aggregation that we have discussed. Now, coming to this particular video, now blood coagulation mechanism. In coagulation cascade or the coagulation mechanism, there is a different chemicals or the coagulation factors are there which prompt the reaction that activate still the more coagulation factor. The process is a very complex, but it is uh, initiated through the two basic pathway. What are the basic pathway? First one is the intrinsic pathway, which is triggered by the trauma. Generally, it is triggered by the trauma. Extrinsic pathway, which is triggered by the trauma, and intrinsic pathway, which begins in the bloodstream and triggered by the internal damage to the walls of the blood vessels. So there may be the extrinsic pathway or the intrinsic pathway. Now, these both of these it will merged into a third pathway which referred as the common pathway. It is common pathway. And there is a different factors are there. Almost 12 known clotting factors are involved, which including the calcium as well as the vitamin K. Now, these clotting factors are secreted primarily by the liver and the platelets. You can find the you can say that notes which were provided. What are the different clotting factors? What is their name and all the details was given. So clotting factors secreted primarily by the liver and the platelet, and liver requires fat soluble vitamin K to produce many of those clotting factors. Calcium ion considered as a factor 4 and is derived of diet and from the breakdown of the bone. Some of the recent evidence shows that activation of the various clotting factors on the specific receptor on the site cell cycle as called as a clotting factor of the platelets. Now coming to the basic coagulation mechanism. Now here we can discuss about the coagulation mechanism. Now this is the intrinsic pathway. Clear? This is the intrinsic pathway, that is the extrinsic pathway. Now we can say that in case of the intrinsic pathway, it may be you can say that activated by the contact, or you can say that internal tissue damage and all. Now factor 12. Yes, factor 12. Now factor A means activated. Let here all the case A means activated, and you can say that so this 12 it will be activated by the contact and other things. So now here we are getting the factor 12. Now high molecular weight kininogen, in presence of that this factor 12 is responsible for the conversion of the factor 11 to activated factor 11. Factor 11 to activated factor 11. Next is calcium, and here it is you can say that calcium it is important almost in you can say that in every process, you can say that. Now this calcium and 11A is responsible for the conversion of 9 factor 9 to 9A, that means activated 9A. Clear? Activated 9A. Clear? And then in presence of factor 8A, then platelet phospholipid and calcium. So factor 9A, factor 8A, platelet phospholipid and the calcium. It is responsible for the conversion of the factor 10 to factor 10A. That is, you can say that 10A activation. Clear? 10 that means factor 10 activation. So that process is generally it is slow and it is known as an intrinsic pathway. In case of the extrinsic pathway, this is generally rapid in nature. Clear? Rapid in nature. Whenever there is a 7 to 7A due to the tissue damage, so here 12A, 11A, kallikrein, all those things it is there. Yes, it is all those things it will be there. And next, this 7A in presence of the calcium and tissue factor 3. Let tissue factor 3, it will potentiate the conversion of 10 to 10A. That means activate inactivated 10 to activated 10. So in both the cases, that is the extensive pathway. Both the cases, there is a conversion of the 10 to 10A. That means activation of that 10. Okay? Now this particular process, it is known as the common pathway. As we have discussed, this is nothing but a common pathway. Now what happens into the common pathway? This activated 10 in presence of calcium factor 5 and platelet phospholipid, it will convert prothrombin, which is factor 2, prothrombin to thrombin. Clear? Factor 2, that is the prothrombin to thrombin. So prothrombin to thrombin activation due to by the 10A, factor 5, then calcium and the platelet phospholipid. Now thrombin is important for the conversion of the fibrinogen to fibrin. Clear? Fibrinogen to fibrin. Now fibrinogen to fibrin, but this fibrin is soluble in nature. Fibrin is soluble in nature. Now if it is soluble, then there will be no clotting. Next is thrombin, it will comes. Let thrombin it will come, and 13A, that is factor 13A, it will come, and thrombin it will come. So what will happen? In presence of the thrombin and the 13A, fibrin, which is soluble nature, it will convert into the fibrin insoluble. Let fibrin soluble to fibrin insoluble. Now if there is a fibrin insoluble, now that is you can say that initiate the coagulant, because it is insoluble in nature and there is a lots of fibrin comes together and they will call the coagulation. So that is, you can say that intrinsic pathway, extrinsic pathway and common pathway, which is responsible for the blood coagulation or clotting.